for you in this course, Diabetes Tale and Pharmacology via Social Cognitive Theory. Congratulations for having this chance, and I'm really so proud to be with you in this course. My name is Maram Abdul Nasser Taha. I am Palestinian pharmacist and American Studies instructor who is teaching on Udemy. Previously, no person realized what diabetes was. No person only questioned that somebody with typical signs and an extremely elevated blood glucose on the situation, but a line on to be drawn amidst those who own diabetes and as well those who performed not, and no person could concur what to sketch it. Diagnosis of kind 1 and kind 2 diabetes in youths offer an essential general and clinical healthness burden owing to the barriers of ailment administration and the risks of chronic and acute difficulties. Biologists dedicate a lot of energy and time to classification and believe this an essential introduction to more detailed realization. Developed in this course is one such psychological method, social cognitive method. A consideration of the source and key notions of social cognitive theory is offered, explained with models from the wide extent of subject fields to which it participates. Then, a detailed dissection of social cognitive theory's contribution to diabetes tale and pharmacology core is presented. Course questions. Some people miss two, anyway, protrude from the different depictions. A disease categorization combines or supports a clinical depiction and links this to the naturalistic history of the trouble and the spectrum of cognitive disability. The situation may then be arranged in expressions of progression or severity, frequently with different curative implications for each step. This, as I shall debate, is at present the situation with our conventional difference between kind 1 and kind 2 diabetes. We demand to believe whether this difference is constantly helpful. Does it perform like a stimulus for idea or as a replacement for it? Does our issue situate in the pathology of ailment or in the path we believe concerning it? Since it is not simple to sketch a stripe for diabetes disease, how much more hard would it be to sketch lines for her of risk factors in collection? Significance of the course. We have moved from trying to terrify commune into health, to recompense them into health, to supplying them with self-regulatory abilities, to control their health practices, to shoring up their custom alterations with dependable public supports. However, these transformations have improved a multifaceted tactic that addresses the reciprocal exchange between environmental determinants and the regulatory of health behavior. The history of therapy for patients with diabetes can be reopened in many milestones. Anyway, more than 80 years in the past, insulin was found out, and it's possibly one of the utmost medicinal improvements of the 20th century. Metformin works via paths complementary to saxagliptin, and as well, the incorporation of saxagliptin with metformin medicine may develop glycemic control. Thus, many patients demand various oral antihyperglycemic agents. The HbA1c concentration shaped through the non-enzymatic connection of glucose to hemoglobin, which is generally recognized to reflect the incorporated mean glucose standard over the former 8 to 12 weeks, and this time period being determined via the 120-day lifetime of the erythrocyte. Who this course is for? People from all of the world who have an interest in the following approaches: clinical pharmacology, diabetes care, principles of organization behavior, health education and behavior, health promotion, nutrition, human learning, endocrinology and metabolism, medical sciences, clinical pharmacokinetics, autoimmunity, clinical chemistry, social learning and cognition, clinical therapy, biochemistry, pathology, laboratory sciences, epidemiology and etiology, and this course contains 67 resources. All I can say, many thanks for your attention, and I'd like to invite you to enroll in this course or try the free preview if you want to explore further.